Hey, what's going on, everybody? It's Dr. Matt from Pinnacle Chiropractic, your local pediatric, family, and prenatal chiropractic office here in the Lakewood Ranch, Sarasota, Bradenton, Florida area. And today is episode 18 of our weekly health cast called Pinnacle's Perspective. So today we're going to talk and continue that talk about stress. Last week's episode, we talked about the different types of stress and how that affects our body, our brain, and our nervous system. So we talked about three types of stress. We've got a little bit of a visual aid for you guys here today. So basically, if you look here, we've got the three types of stress up top here. So we've got physical stress or traumas, the chemical stress, which are toxins, and then emotional stress, which are those thoughts. So the accumulation of those three stressors are what really influence the nervous system. They stick that nervous system into more of a sympathetic stress mode of the body. And so what we talked about last week is there's also two types of stress, acute stress and chronic stress. The acute stress is just short-term stress where our body is able to overcome that stress and get out of that stress mode. The chronic stress is where it overwhelms our body. It's long-standing stress that's been present for weeks, months, years, that overwhelms that body and sticks it into more of that sympathetic fight or flight stress mode, and it gets stuck there way more often than should be, which then leads to a slew of different challenges. So in today's episode, I really want to talk about the technology that we use in our office, show you the technology that we use, and then show you what a typical scan printout looks like using that technology. So in our office, we have state-of-the-art technology that measures stress on the nervous system, on the spine, on the nervous system, on the brain. And so this technology is totally non-invasive. There's no radiation, there's nothing harmful emitted from this technology. It's non-invasive technology. And so we can literally do these three scans in a matter of about 10, 15 minutes tops. So they don't take a super long amount of time, but the information that we're able to gather about how stressed the person or child's nervous system is really invaluable, because that's what really allows us to build out and plan for the amount of care that your child or the adult needs to get their nervous system working properly, to get that stress calmed down off of their nervous system. So in our office, we utilize three different scans. Depending on age, we're only able to get maybe one in the very young ones, infants and toddlers. And then the second one that we'll talk about, we can usually get two on some of the older kids. And then the third one, we're able to get on pretty much like the teenagers and the adults. So 1 to 3 tests depending on the age. The first one, this is the one that we can get on everybody. I'll show you what it looks like. So this is called our rolling thermal scan. So basically what this is it's like a giant thermometer that measures heat coming off of the spine. Now what this is doing is it's measuring that inflammation and dysfunction within our autonomic nerves of our nervous system. So this basically, when we turn it on, like I said, it's like a giant thermometer. What we do is we start at the base or the sacrum tailbone area of the spine, and then we roll it up the neck. So basically just rolls right up your back, getting skin on skin, making sure that this touches the skin as we roll it up, and that's what's really going to measure that heat and inflammation along the spine. So I'll show you guys a visual of what we use when we print out this scan, what we can really see. So we see this visual aid here. We've got the brain up top here. We've got the spinal cord that goes down through the middle of the spine here. And then each level or segment of the spine, we have nerves that go out to supply different blood vessels, organs, glands, systems of the body. So with this particular scan, we can see where exactly the inflammation is and where those problem areas are at. So a lot of people associate all these nerves coming out through the spine. They associate those with pain, but actually only about 10% of their function is pain related. The other 90% is going to be controlling our organs, our glands, our systems, our muscles of the body. So this really gives us a good idea of what's going on and where those problem areas are at. And then we can match it up with the symptoms that your child is experiencing or you're experiencing. So a lot of our kids that we see that have stressed out nervous systems, that have a lot of sensory stuff, anxiety, ADHD, autism, those type of things. Usually we're going to see this upper neck area, the brainstem area, show up as having a lot of moderate to severe inflammation. Then another big area right here is the T8 to T12 area in those cases, and especially adults as well. This is where these nerves supply our adrenal glands, or those stress glands of the body. So this scan really gives us that idea of where exactly those problem areas are at, where the inflammation's at, where the dysfunction is, and then we can 9 times out of 10 match that up with the symptoms that the child is experiencing or the adult is experiencing. So that's what the first scan looks like. And at the end, after I show each piece of equipment, we'll show you what a printout of those scans look like and how we can measure those things. So if we look at the next scan here, this one is what's called our surface EMG, or surface electromyography. So what this is doing is it's measuring the overall tension along the spine, the muscular tension. So when we do this scan, what we're doing is we're basically starting at the neck area and working all the way down, measuring at various points along the spine for that neuromuscular tension. And so this will give us an idea of really how stressed out that person is. So whenever we talk about tension stored within the spine, within the body, is it's really stress that's stored there. So with adults and women, we mentioned kind of last week, we see them store a lot of their tension and their stress in this lower neck and shoulders area and upper back area. And so the second scan really gives us an idea of how stressed out that child or that adult system really is and how much tension it's holding on to. And we'll show you a little bit as we show you the printout of what the detailed data we can actually derive from that scan. So that's the second scan. The last scan is basically using this little contraption here. You insert your left hand in like so, and what it's doing is it's measuring the heart rate variability, which basically is the gold standard for measuring that stress on the nervous system. So it will take that heart rate variability, take your heart rate from your middle finger of your left hand, and in some of our younger population, we also have an ear clip that we can put on to measure that heart rate from the earlobe. And so what this does is it really tells us the balance between that sympathetic stress mode of the nervous system and the parasympathetic mode, that rest relaxation mode. And then it also tells us the energy reserves of the nervous system, of the body. It tells us how much energy that body is using to do all of the different processes that it has to do throughout the day. And so those are what the 3 scans look like. Like I said, they're totally non-invasive. There's nothing harmful. There's no radiation or anything like that. So we can perform these scans on as young as infants and as old as anyone. So at any age, we can really do these scans, and they're not going to be harmful or emit any harmful radiation or anything invasive like that. So let's talk lastly a little bit about what a scan looks like in our office. So actually, after we do this evaluation, measure that nervous system for stress and dysfunction, then we get a nice little printout here, a nice little visual aid where we can really go in depth with describing what we see and what we found and what's going on. And like I said, this is what really helps us develop a good plan going forward to see how that child or that adult's nervous system, how stressed it is and how much care it's really going to require to calm it down. So look here, we've got a few different scans. that we look at. This first one here, that's that first scan that we talked about. That's that rolling thermal scan. And so this is the one that rolls up the back, measuring for that heat and inflammation. So you can see in this person's scan, we see a lot of inflammation in that neck area. So once again, that's really a stress area, and anxiety, stress, and low energy, those type of things we see correlated with that inflammation in that upper neck area. So when we see a lot of color on these scans, that's an indication that that nervous system is stressed out, it's inflamed, it's not working the way it's supposed to. In a perfect world, we really want these scans to be as close to being all white, little to no color as much as possible. So the red bars are going to be like the most extreme amount of inflammation, most extreme amount of tension when it comes to this scan. So the second scan here, this one is that muscular tension scan that we talked about. So this is that second scan, and that tells us kind of where that stress and tension that person is holding them. So in this person's scan here, we can see that most of their stress and tension is kind of in that mid to upper back level there. He's got a little bit in other areas, but that's where the main areas of that stress and tension lie. So and also gives us a little printout here, which is probably too small to read these, but it gives us 3 different numbers here. So it tells us the total amount of tension that that person's holding, and we can know this. It's basically on a 100% scale, and so we can tell how much more tension they have than what the average or normal is. And then it will also give us the organization of that musculature. So basically, when we're talking about dealing with the spine, the neuromuscular tension distribution should be the least amount of tension in this neck, upper back, and mid back area. We should have the most normal amount of tension in kind of the core area or the stability area of our spine. And so that second score really gives us an idea of how organized that muscular system is, and if they have the tension in the good places or if they're in the wrong places, essentially. And then the last score that it gives us is called the symmetry. It's basically the muscular balance. So it tells us side to side if one side's tighter than the other side and how balanced that neuromuscular system is along the spine. And so those 3 numbers will give us 3 specific measurements that we can measure and track as we go along. This is really going to tell us the progress that we're making. And then this last one here, this one is that heart rate variability. So it tells us that stress. So if we look a little bit closer here, we can see this midline here is good balance between that sympathetic and that parasympathetic, or that stress mode and that rest relaxation mode. And then this white dot here is where the person is plotting. So this person had pretty good balance at the time of the scan, but what we see is this white dot ideally should be up in this green zone here. And so the lower it goes, the more energy the body is using. And that tells us really how much chronic stress load that nervous system, that body has been under. The lower it goes, the more severe that chronic stress load is. And so in this person's case, this is actually a teenager that we take care of. And in a teenager, we shouldn't see this even outside of that yellow range. We're seeing it start to creep into that orange range. And so this tells us this person has been under a lot of chronic stress for quite a few years on their nervous system and on their body. And so that gives us a good idea of how long they've been under a great deal amount of stress, essentially. So that's what the scans look like in our office. So one of the cool things about our office is that we don't just do this once, especially in the beginning phases in our intensive care. We're going to continue to measure these things on a once-a-month basis. So we're going to check in to see how we're doing with the goals that we set with our care. And then we're going to check in to see how we're making changes to those scans, because that's what's really going to tell us, is their nervous system releasing some of that stress? Is it adapting to that stress? Is it improving? Because that's what's really going to create the long-term change in those person's symptoms, is really getting to the underlying cause, which is that neurological dysfunction. So as we go through care, we'll be able to measure and continue to measure that stress on the nervous system to see the improvements. And so once we see that the goals are being met, and then we're seeing those scans calm down, then what we're able to do is we're able to go back to more of a wellness maintenance type of phase of care where we don't have to see the person as frequently or as intensively, because we've got their nervous system calmed down, we've got it stabilized, we've got their symptoms stabilized as well, which then makes, like I said, for more of a long-term solution than just going after the symptoms of kind of patching it and then the things come back and then you might get rid of them. What traditional chiropractors and chiropractic offices do, and a lot of medical doctors as well, is they just patch those symptoms. They might get rid of the symptoms temporarily, but they just come back as soon as you kind of stop going on that regular basis type of thing. With our care, we do recommend that ongoing maintenance care to keep them at bay, but once we're in that maintenance phase, we're not seeing those symptoms come back as often as we did in that intensive care or at the level of the severity. So we're able to make those long-term changes, which then are going to create long-term gains for that child, especially in children, because when we're talking about children, their brain and nervous system is developing very, very rapidly. When we calm that nervous system down and we keep it calmed down, it goes into that growth and development mode. So a lot of the kids that we take care of that have developmental delays, or they might have the emotional maturity of a child a few years younger than them, they're able to start catching up. Now, this isn't usually like an instant thing. It's going to take time for the brain and the body to catch up, but it's going to catch up and develop with their peers, especially those that are a little bit more developmentally delayed, like the speech delayed children. Or the, like I said, emotional maturity in children. We'll see all of those things catch up, and they'll be able to control their emotions better. They'll be able to speak more words, speak clearer with a lot of the patients that we take care of that have those developmental delays. So I hope you guys enjoyed this episode and you got a little bit more in-depth knowledge and saw our technology that we use and how kind of our process of measuring that stress on the nervous system works, and how we're able to continue to measure that and track that progress, especially in those intensive period of cares. So if you guys enjoyed this video and you think that you know somebody that could really benefit from our care, that you know that maybe they live a very stressful life and they have a lot of symptoms that they're trying to manage or deal with, or you have children that you can see the stress building in them, especially going back to school, then please share this with any of your friends or family that might benefit from finding out a little bit more about our office and how we measure that stress and how we help with that stress. And so we would appreciate if you shared that, comment in the comment section below with any questions, and tag any of your friends or family, like I said, that would benefit from watching this video. So as always, guys, I'm Dr. Matt, and we will see you guys on our video next week, and be well.